Today, we're diving deep into one of India's most powerful health safety nets, the ESIC Medical Benefit Scheme. Have you ever wondered how it really works, who it's for, or how you can actually make the most of it? Well, you're in the right place because we're about to break it all down for you. And this right here, this is the core promise, the big idea behind the entire system. From the very first day you start an insurable job, you are covered. We're not talking about a waiting period or a probation period. No, we mean literally from day one. That's a huge sense of security right off the bat. And believe it or not, it gets even better. What's truly incredible is the scale of this promise. There is no ceiling, no cap, no upper limit on how much can be spent on medical care for you or your family. Think about that for a second. From a routine checkup to a major life-saving surgery, it's all covered. So, to make sure you've got this all figured out, we're going to walk through this 5-part journey together. We'll kick things off with what ESIC is all about, then we'll get into how you get your all-important ID, the actual path to getting treatment, what to do in those rare cases you pay out of pocket, and finally we'll look at the digital tools that put you in control. All right, first things first, what exactly is this massive health safety net we're talking about? Let's get a crystal clear idea of what it is and, more importantly, who it's designed to protect. At its core, ESIC is India's #1 social insurance program, and its goal is really simple: to provide complete, totally cashless healthcare. And this isn't just about you, the worker. It's built from the ground up to protect your entire family from the huge financial burden that medical bills can create. And when we say entire family, we mean it. The coverage is incredibly broad. It's not just you, the insured person, who's covered from day one. It's also your spouse, your kids, and even your parents. And this is where you see the real forward thinking. Even after you retire, you can stay covered for a tiny annual premium of just 120 rupees. The same goes for permanently disabled persons. It's a safety net for life. Okay, so now you know you're covered. That's great, but how do you actually get in the door? Well, it all starts with a simple registration process and one very, very important piece of plastic. Your journey to getting set up is actually a super simple 3-step process. First up, your employer kicks things off by registering you on the ESIC online portal. Next, you'll just need to pop into an ESIC office for a quick biometric session. They'll take your fingerprints and a photo. And that's pretty much it. You get your permanent e-patient card, which is literally your key to unlocking every single benefit. But what happens if you need to see a doctor before that permanent card is ready? Don't worry, the system's got your back. You'll get what's called a Temporary Identification Certificate, or TIC. It's good for your first month and makes sure there is absolutely no gap in your healthcare coverage. You're protected from the get-go. Now for the really important part. You're registered, you have your card in hand. How do you actually go see a doctor or get treatment at a hospital? Let's map out the entire pathway so it's perfectly clear. The easiest way to think about it is like a 3-level system. For your day-to-day health stuff, your first stop is always an ESIC dispensary to see an insurance medical officer, or IMO. Now, if your condition is more serious and you need to be hospitalized, that same IMO will refer you to an ESIC hospital. And for the really advanced stuff, like major surgeries, you'll get a referral to one of over 750 top-tier private hospitals that ESIC partners with. Okay, this next part is absolutely critical to understand: the difference between a non-emergency and a real emergency. For any planned hospital stay, you must get a referral from your dispensary first. It's a structured process. But, and this is a big but, in a true life-threatening emergency, you can and should go directly to the nearest SEIC or approved private hospital. No referral needed. Your health comes first. And for those major treatments we talked about, things like cancer care or heart procedures, the entire process is always cashless. You never have to worry about paying massive bills up front. The only thing you need to remember is that you'll need that formal referral from an ESIC doctor to get access to that incredible network of super specialty hospitals. Now, while ESIC is designed to be a completely cashless system, there are a few very specific, very exceptional situations where you might have to pay first and then get your money back. This is all covered under a specific rule called Regulation 96A. So when can you actually claim a reimbursement? Well, it boils down to 3 main scenarios. First, if you get emergency treatment at a private hospital, you've got to let ESIC know within 48 hours. Second, if the dispensary is out of a medicine you need, you have to get an official out-of-stock certificate. And third, if you need a specialized test that isn't available in the network, you'll need a formal recommendation from an ESIC specialist. And if you do find yourself needing to file a claim, here's your essential checklist to make sure it goes smoothly. You have up to a year to do it, but honestly, the sooner the better. You'll need all the original bills and prescriptions, your discharge summary if you were in the hospital, and of course, a copy of your patient card along with your bank details so they can send the money right to you.
To wrap things up, let's look at the fantastic modern tools you have at your fingertips. ESIC has really stepped up its game, creating a whole digital ecosystem to make managing all of this way, way easier.
All right, get your phone out because this is your actionable toolkit. First, download the Umang app. You can get your ePatient card right there and track services. Second, bookmark the ESIC IP portal on your computer. It's perfect for checking your eligibility or finding a hospital near you. Third, save this number, the toll-free helpline, 1-800-11-2526, for instant support. And finally, if you ever run into a problem, there's a dedicated online portal to file a grievance and get it sorted out. So there you have it. That's the complete map to your ESIC medical benefits. You now know how this fantastic system works, from getting your card all the way to getting advanced treatment. So the only question left is, now that you have this knowledge, how will you use it to protect your family's health and well-being?